Many people in the Peace Corps, most, are volunteers. I went over as a staff physician to Ethiopia from 64 to 66. Overseas, I learned about poverty, I learned about injustice, I learned about a few things done well can make a huge difference in people's lives. And then I was actively involved in treating things you simply never see in the US, but are real killers when left untreated. The volunteers kind of adopted students and whatever. And this kid had a horrible infection in the bone in his lower leg, but with very high doses of oral antibiotics and a drug that kept the penicillin in the body. This kid went home and he was cured, and he would have lost his leg for sure. And I thought, that's kind of a rewarding thing. And that treatment, the antibiotics, were pennies a day, yet unavailable. And you think how many people suffer from the lack of access to basic medical care. I went from a career which would have had me as a cardiothoracic surgeon into public health. And I went back to Washington to be first medical director of the Job Corps, which is a program which takes kids from disadvantaged neighborhoods. They were Black, white, Hispanic, Appalachia, Watts, and gives them job holding skills, technical skills, reading, writing, math skills, and also looks after their medical needs. And I was struck by the enormity of the social injustice we had at home, by the degree of segregation and what it meant. So I worked in the poverty program for a number of years. I think the important thing about Peace Corps today, it gives you an education that is simply not achievable in the classroom on Wall Street, and it sets the stage for a wonderfully satisfying personal and professional life, and I can think of no better way to start one's career than a couple of years in the Peace Corps.